Substance use disorder carries a stigma in practically all communities, but for many new Mainers, especially those who are Muslim, getting help can be more difficult because Islam prohibits substance use of any kind.
Now a new nonprofit is helping to break down barriers to getting help. It's called Generation Noor, and as News Center Maine's Vivian Lee tells us, it was started by an immigrant. The goal is to make treatment and services to immigrants of all generations more accessible.
Amran Osman vividly recalls the pain of losing her brother to an overdose in 2021. But the silence after his death was even more devastating.
Nobody talks about it because it's forbidden in Islam, correct? So you're less likely to talk about it because there's this big stigma.
Those beliefs can include that addiction is shameful and that discussing mental health issues outside of families is strictly taboo.
My peers were struggling with substances and mental health, but nobody was really talking about it. Community roundtable discussions.
Amran was born in Kenya after her family fled from war-torn Somalia, settling in Lewiston when she was 3. Studies have shown that Muslims living in Western cultures are more likely to have addiction issues than those in Muslim-majority populations. Immigrants can also have limited access to mental health services to the general population. After Amran graduated from the University of Southern Maine, she wanted to break down barriers to treatment for new Mainers.
A lot of people were wanting help, but they didn't know how to ask for help or get help. So that's why I wanted to start these conversations.
Last year, she launched the nonprofit Generational Noor, which means light in Arabic. She started holding roundtable discussions in Lewiston and in Portland at Gateway Community Services, where she serves as a community resources coordinator. Over time, these transparent conversations about mental health, addiction, and treatment have helped start the healing process.
Their walls go down and they're able to have these conversations as they get to know each other, and they are able to understand that it is a safe space.
Generational Noor has gone from 4 to 27 volunteers, supported by a board ranging from university students to health professionals like Isha Khan. Khan, who is originally from Pakistan, is a program manager for oncology services at Maine Health. She says the nonprofit is working to translate mental health resources into more languages, expanding telehealth services, a model that could go statewide.
Can be replicated and also be customized to, Bangor and other areas that have not just immigrant populations, but diverse populations that can really benefit from these services.
Amran's efforts landed her on a recent cover of Journey magazine, created by people in recovery, as she continues to work to make sure resources and flyers with information more accessible, multilingual, and culturally appropriate.
Would this be able to be put in a mosque? Would this be able to be put in stores?
For generations to come. In Portland, Vivian Lee, News Center, Maine.
And as always, if you or anyone you know is struggling with mental health, you can call or text 988 for some help.